Hello, dear listeners. This is your host Mugdha Kalra, welcoming you once again on the latest episode of our podcast series Rainbows of Hope, brought to you by Rainbow Children's Hospital, India's leading chain of multi-speciality childcare with 16 hospitals spread across 6 cities, in association with Earshot. In this unique series, we are bringing to you the wonderful world of children and their angels from God, their doctors. We always hope for our children to be happy and healthy, don't we? But if in case something goes wrong, we need to be strong, we need to be aware and hopeful. This is precisely what this series is all about. Hope. Hope that also the doctors bring to us. In the first 3 episodes of Rainbows of Hope, we have discussed autism, blood disorders, and cardiac complications in children with experts from Rainbow Children's Hospital. In the 4th episode today, our guest is Dr. Babu S Madarkar, a renowned neonatologist and pediatrician from Rainbow Children's Hospital, Marathahalli, Bengaluru. He completed his MBBS and MD from PGI Chandigarh and DM Neonatology from Delhi. Dr. Babu S Madarkar is a member of AMS New Delhi and recipient of a certificate from the International Programme on Preterm Nutrition from Westmeads University, Australia. His area of expertise include handling low birth weight babies, hypoxic babies requiring conventional and high-frequency ventilation, complex neonatal emergencies, and common surgical cases related to NICU. He has a wide-ranging experience from across many hospitals. Welcome, Dr. Babu.
Thank you so much for that nice introduction.
Dr. Babu, the motto of Rainbow Children's Hospital, Marathahalli, Bengaluru is, "It takes a lot to treat the little." And you are perhaps treating the littlest of the little. So let me start by asking you, what drew you to this branch of pediatrics?
Yeah, for me, this idea of becoming a neonatologist is kind of a more of emotional as well as more of personal. I, as a small child, have seen my baby brother dying in my lap. And for any person, I think this is one of the worst experiences that as a child one has. It came to me as an instinct, not as an aim, to make myself capable to be able to offer help to people so that they don't see such situations. Then later on, as I grew up, then I thought there is a branch in medicine which is called pediatrics. And when I finished my pediatrics MD, then I got to know that there is a new branch which has come up in India, which is neonatology. And I thought I should go into it and offer my best of my experiences and expertises.
How wonderful, doctor. And always helps when there is a personal mission and a backstory. I think it adds so much purpose to the passion. Dr. Babu, neonatal is what age bracket? And when we talk about mothers and expecting moms, what are some of the things that they should be careful about, they should be monitoring closer to their 3rd trimester and once the baby is with them? What are some of the things that you advise that they should be careful about? Because I do know that usually you have your gynecologist. So gynae and obs is what you are in touch with. But at what stage does somebody with your expertise come in, sir?
To answer to your first question, what is a neonate? Neonate it is restricted to time period of 28 days. When a baby is born, from the date of birth till end of 28 days is called as neonatal period. And this time is distinctively mentioned because the kind of diseases, kind of illnesses or issues that are coming to the baby are completely distinct as compared to any other age group. But then as a neonatologist, we take care of babies even before then. Normally, baby stays in mother's womb for a duration of 9 months, and a time period from end of 9 months to next 28 days is our time. But then if the baby is born before 9 months, whether it is 6, 7, 8, 9 months, those babies also have their own distinct issues and concerns and problems. The neonatologist also deals with those problems. Now, coming to your second part of the question is when should a neonatologist participate as far as mother care is concerned or a baby care is concerned. I feel participation should be even before the time of delivery. The obstetrician gives a good idea about health of the mother and health. How is this health going to impact the outcome in terms of the end result, which is the delivery? So mother has to undergo a lot of processes with respect to her health, bodily changes, emotional changes, and so on and so forth. For that, there is assistance which is given from the obstetrician side. But with the perspective of baby also passes through multiple stages of development. Could be development in the lungs, brain, heart, kidneys. All those things have to be well perceived by the neonatologist so that he or she is ready even before the time of delivery, so that all the best of the care can be given to the baby at the time of delivery. So I think I personally feel it should be a team. The obstetrician and neonatologist in combination is called perinatology team. They should go hand in hand till the time of delivery and give best of the best care to the mother as well as the baby, which is we call it as dad, DYAD, dad.
How interesting is that? And you introduced me to a new term, which is perinatology. It's a tongue twister. So, doctor, what would you advise the new moms, expecting moms, to watch out for in the last trimester and in the first 28, 30 days? What should they be watchful about? And then, of course, we will come to specifically the neonatal issues. But for a regular parent, what should be the protocol so to follow?
Yeah. As a doctor, if you have to say, we have to see how is the heart beating and how is the baby's oxygen levels and all those things. But as an end result, the baby keeps on moving around at fixed intervals, at regular intervals in the mother's womb. So expectant mother should identify the baby's movements, should be able to perceive the baby's movements, and she should have a daily counts of the movements. And if she feels the counts are happening as regular, as frequently as it was happening previous, that means baby is doing well. If there is an increment in the counts or decrement in the counts of fetal kicks, movements, those perceptions, if they're lesser than the normal or more than the normal, I think that is a time when she has to visit the hospital and show herself. I think the best way to identify baby's health is by perception of movements. So she should continue to do those movements, to count those movements till the time of delivery. Once the baby is born, the issues with regards to baby care is first thing is the colostrum. Colostrum again is a first milk which a mother is able to give. The first milk is rich in all antibodies. For any mother who is around, maybe for example, let us take there is a 30 years age age of the mother is 30 years, and she would have had multiple infection in her lifetime, which could be common cold, stomach pain, or infection anywhere in the body, and she would have kind of produced antibody against those specific diseases, and all those antibodies are in high stores in the body. And as she is giving her first milk, she is giving all the antibodies, all that immunity against those diseases to the baby. It's kind of giving first immunization, first vaccination to the baby. So baby gets all the immunity to the self body, and there's no vaccination which is bigger than this. This is like a first vaccination. So to give this, normally what actually happens is when a mother has just delivered, she would have passed through a lot of pains and she would have become exhausted because of the process of the delivery. And it's very difficult for anybody to motivate her to feed the baby. If we train the mother, teach them importance of this important thing, which is colostrum, which I call it personally as birthright of a baby. So to motivate, it takes a lot of time. We have to train the mother. We have to make the mothers understand that importance of colostrum goes in a long way, and it helps the baby to give great immunity. If they are well motivated, I think every mother will be able to give first colostrum. And after that, sustaining continuity of milk and being able to feed the baby as per the baby's requirement is also very important. If I have to say, in the current era, everybody knows, all mothers, current era, good number of them knows that there is a lot of benefit in terms of decreasing infection, in terms of decreasing hospital visits, and baby does well. One more addition I would want to do here is it has something to do with improvement in the mental development. So if a baby, for example, if I have to say, is destined to get 100 out of 100 in the mathematics at 10th standard, and if this baby receives mother's milk, this baby will definitely get 100 out of 100. But then if baby receives formula milk, there is a difference of 22% of decrease in IQ. And this baby, if receives only formula in the first 6 months of age, and at end of 10th class, he will be receiving only 78 marks. And there's no point in scolding the child at 10th class. He and she in coming years will ask back, why didn't you give me formula milk, and why didn't you give me your milk? So there is a lot of difference, whole lot of difference between the IQ of a child who has been breastfed as compared to a child who has been formula fed or any other feeding being given. So there are certain things which actually happens, like every baby will have a little bit of jaundice, some kind of little sneezing, hiccups, and some rashes on the body, which is quite natural and quite normal to have in the early time, and parents don't have to be anxious about those things.
Okay. But when we talk about specifically neonatal issues, what could be some of the most common issues that happen and that you encounter, and also what are some of the complications attached with that?
Okay. There are certain issues. If you have to divide this neonatal part again furthermore into normal newborns and premature newborns, the issues of newborn babies are different as compared to preterm newborn babies. So newborn babies suffer from issues, as I mentioned, like jaundice, which is a very common thing that we see in various part of India for various reasons. One could be because of traditions of not feeding the baby well or early, and letting the baby lose weight, and then baby develops jaundice. Certain other things are that there are some tradition to apply various things to the baby, which could be applying application of some lotions or oils to the umbilical cord, putting drops in the ear or eyes, and all those things. They end up causing infection to the baby. So good number of babies we do still see visiting our hospitals suffering from infections. So neonate will suffer from infection. If at all, the infection issue in the neonate is a little different. Unlike in adults, the infection get localized wherever it is, but in babies it tends to spread all across the body. So these babies end the breathing difficulties, going into various issues like decrement in the heart rate, fall in blood pressure, and these babies worsen very rapidly and end up in NICUs. So these are two common things. Other things are fall in blood sugars and all those things keep on happening. But then if the baby is being fed well and well taken care and well addressed with respect to temperature maintenance, I think those babies do good. When we come to prematurity, the issues depends on how premature is the baby. So overall, if you have to speak, it depends on how well is the heart or lung or brain is developed. Most common issue that we see at the time of delivery in the preterm babies is with regard to difficulty in breathing. Since their lungs are not well developed, lungs are not inflating well enough. So these lungs will be almost like stiff balloons, which babies taking a lot of effort to breathe. So in these babies, we offer supports like putting medication into lungs and offering respiratory supports like ventilator. And likewise, the blood vessels in the brain are very weak, and they tend to burst out and bleed into the brain, and that also causes long-term issues, might cause long-term issues. They catch up infections in the blood, and it flares up very aggressively, and these babies might succumb to those infections as well. And intestines are very delicate, thin, and they do not function as well as a normal baby. So it takes a whole lot of time to make sure that these intestines are functioning well enough to offer feeding to the baby. So all these are kind of different varieties of concerns or issues that we see in term babies or preterm babies.
Dr. Babu, when we talk about premature babies, also lovingly referred to as preemies, what are the reasons for premature delivery, and how soon into your trimesters can you actually figure out about a likely complication, and what is the outcome that one sees in this case?
So, of late, we have been observing a lot of more and more of babies getting delivered. The common reasons what we figured out was that age of conception has not been normal. We have seen mothers delivering early or very late. Uh, More so in India, it is very late because of the fact that more and more people are going behind education and careers, and all this whole lot of time is going to get used for settlement of these families and careers, and then they're getting married, and then late conception, late pregnancies. These are the one major reasons why what we're seeing. And second reason what we have observed is stress level in people has increased to a great extent. People under stress do tend to produce premature delivery. And because of these kinds of things, we are seeing that they are not able to conceive. Hence, they are going to go to resort to a new solution, which is called IVF. And babies who are born in IVF, they tend to be born more prematurely. But then, as a parallel, we have various solutions to these babies who are born prematurely. And there is a conception amongst people that premature babies end up to do not have a good neuron, good brain. They do not do well with respect to the brain as they grow up. I would want to understand, I would want a listener to understand that the greatest scientist of the world, Albert Einstein, was a premature baby. Isaac Newton was a premature baby. Napoleon, who ruled the world, Alexander, who ruled the world, were all premature babies. It doesn't always goes hand in hand that premature babies do not do well. If we offer them best of the best, they definitely will do great in their life.
Dr. Babu, when we talk about medical science, it has become the science of miracles. And when we are looking at babies born prematurely, at even 5, 6 months, they make it through the complicated times. But what are the latest facilities and technologies that are perhaps making this possible? And even Rainbow has a full NICU equipped wing. What are some of those facilities that are now absolutely required in hospitals? Because we are also seeing premature babies. Preemies do happen very often, and whether it is got to do with a stressful pregnancy or whether it is predisposition. But what you actually need is a super speciality setup where your child is completely taken care of, because they are outside of the womb, but in a womb-like place.
Yes, yes, yeah. Yeah, if you go back to history of Indian scenario with respect to neonatal care services, if you go to 1980s or 1990s, we would call it as a miracle if a baby who's 1.5 kilos survives. Now the facilities have improved. More and more people are coming. More and more experts are coming, and they're offering their expertise, as well as that newer technology and all these kinds of things and newer evidences, new researches are helping us to go in a direction wherein we are able to save younger babies. We routinely save babies who are 700 grams, 800 grams, 900 gram babies. We currently have a good number of babies who are even 500 grams, 600 grams babies. So if you go back in terms of gestation, 9 months, even 8 months, 7 months, 6 months, and 5 months babies are also being survived.
Dr. Babu, what are some of the genetic predisposition in neonatal issues? Are there any genetic predisposition issues? Also, how soon into your trimesters can you figure out a likely complication? And then what should be the protocol like?
Yeah. So, as a whole, if you have to say, there is no genetic predilection for all the babies. But then it's very important to understand what is happening to the baby, so as to we offer some kind of benefit to the baby, so that this baby is going to survive. And now, how to do that? Now, since the science and technology has improved, we can identify the baby's genetic status as early as even at 14 days of conception. But then routinely we ask them to come for follow-up. There are various times wherein we can intervene and do identify the situations inside. We can take little water from the womb, test it, identify what is the solution for that. Identify first the issue, then give a solution. Sometimes, very rarely, what happens is this baby will not be able to make it if we identify that this dangerous condition is there. So in those situations, we inform to the parents and it is the parents who will decide what has to be done to the situation. But then we have come to a state that most of the conditions can be identified even before the time of the first trimester, and we can follow it up in the second trimester, and we can take appropriate call at that point of time.
Dr. Babu, a very quick question before I end. I'm sure you get 100 questions about neonatal regular care, which is when do you give the first bath, how much sun exposure is essential, what should be the weight like. Those questions every mother asks. So very quickly then, what are some of the tips that you can give to our listeners?
Yeah. I should say the process of birth is a normal process. It is a physiological process. We don't have to be worried extremely about those things. Once the baby is born, we tend to even overdo or do less. One thing that I would want to tell to all parents is initiate breast milk as little as possible, continue breast milk and all those things. These are good, very good. Some parents keep on weighing the baby everyday basis and tend to interact with the doctor and try to identify what has to be done and all those things. We don't have to be, God has already given a very good software and very good hardware, and babies can sustain themselves well. And it is very important to give the good sensorium to the baby, talk to the baby, sing to the baby, give tender love and care, wear colorful dresses, dance in front of the baby, stimulate all the sensorium. Baby does very good with respect to the brain development. And along with that, take usual care, keep the baby clean, keep the baby warm, feed as per the demand of the baby, and monitor as per the body's requirement and as per the advice of the doctor of the baby.
Fantastic. I think your insight was actually required because this makes for a great answer actually. And a lot of people, because a lot of times you wonder, that if the pregnancy has been fine, what is the reason for premature babies? I myself had no idea that it is also because of the age of pregnancy that it also sort of
and the second part
causes
of
complication.
Many of times we see parents saying that I don't want this baby. Baby is not good. This baby is not going to do well in future. They don't offer services for the fear of baby not going to do great in life. But they also do better than normal babies as well.
Thank you. Thank you so much, Dr. Babu, for taking out time and speaking to us. This was wonderful.
Yeah, thank you very much for making part of this. Thank you so much.
Well, that's it for now in the 4th episode of Rainbows of Hope. Parents and near and dear ones of our little ones listening to our podcast. We have Rainbow 1 for complex and critical cases. You can contact the Rainbow Children's Hospital, Marathahalli, Bengaluru at 1-800-2122, 1-800-2122, I repeat again, or email at queries@rainbowhospitals.in. We'll be back soon with our next interesting episode. Stay tuned to Earshot on www.earshot.in. You can download the Earshot app from the Google Play Store. Our podcasts are also available on Spotify, Google Podcast, JioSaavn, Apple, and Gaana. Stay happy, healthy, and always hopeful. Bye-bye for now.